Officials say the spread of Ebola here is not really a threat. KXY4's Caiti Currey working for you with how Spokane health officials, though, are still preparing for the worst. Katie?
Nadine, health officials say the chances of Ebola coming to the region are slim to none, but they aren't taking any chances. There are currently no active investigations of Ebola in the inland Northwest, but if there ever is, officials say Spokane is prepared.
Most places in the U.S., including Spokane, are well equipped to handle any person who may, develop Ebola.
Dr. Joe McCullough with the Spokane Regional Health District says there is nothing fancy about treating Ebola.
It's pretty much standard infection control precautions, making sure the person's in a single room by themselves, making sure that there's proper protective equipment for healthcare workers.
Because people from Spokane continue to travel to West Africa, they are not ruling out an outbreak here completely. Though people leaving the infected countries are screened before they leave, it could take up to 21 days for someone to show symptoms.
That's the main risk of someone who is potentially exposed there, travel, and become ill once they arrive here in the U.S.
But Dr. McCullough says, fortunately, none of the affected Americans that have been transported to the U.S. with the disease have died.
Ebola certainly is a scary disease. The good news is that our healthcare system here in the U.S. is well equipped and, more importantly, prevent the spread within the population.
There is no known treatment for Ebola, but health officials in the U.S. perform what they call supportive care, things like proper hydration and nutrition, treatment of other infections that may form as well, and eventually the body will heal on its own. Reporting in studio, Caiti Currey, KXLY4 News.